care you deserve today. Call 910-703-3386.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones, and today we're covering two important programs that can help you with your medicine and your doctor bills. The Cumberland County Medication Access Program, or CCMAP is what we call it, or was what I call it. Did you know that this isn't limited to Cumberland County residents? We have the details coming up for you. And also, we're going to talk about Medicaid expansion. You remember statewide new rules came into effect. Well, we have with us today that will get us updated on that. And it's Mr. Bart Pfizer. Mr. Pfizer, he is the Vice President of Revenue Cycle and Managed Care at Cape Fear Valley Health. Mr. Pfizer, welcome to the broadcast.
Thank you, Ms. Jones. It's a pleasure to see you again, a pleasure to be back part of this program.
Thank you so much. Now, Mr. Pfizer, I am seeing all kinds of commercials right now about Medicaid expansion. And the new benefits that are available. And to me, it's kind of complicated to figure it out. So do you have a quick and understandable version of who is eligible for Medicaid now versus before?
Okay. So if you're confused, welcome to the masses. It's a moving variable. So, nothing to be ashamed about, embarrassed about. It is confusing. It's important. I'll give you the high level, but it's important to know that each individual may have differing circumstances, and so it's always worth reaching out to Department of Social Services, coming out and talking to an eligibility expert, which I know we'll talk about here in a little bit. But high level, if between 19 and 64 years old, if you're earning about 138% of the federal poverty level, so an example, think about a single earning about $20,000 a year, or a family of three earning about $34,000 a year now are eligible, where those numbers used to be, a little bit more significant. So it did pick up. But what's exciting about the eligibility, just to give you a high note, and I know it's not on the question, but this is why it's really, before we bog it down in regulatory, which it can be, what's super exciting is 600,000 North Carolinians are now eligible for health care insurance that weren't as of before the 1st of December. 300,000 automatically. So those that were in family planning and some of what we'll call limited coverages are woke up to coverage. Another 300,000 mixed between some of those that were made active during the waivers during the pandemic, had to go through revalidation, and then another 200,000 based on the income and levels that we talked about are also now available to have that insurance. So really, for our community and others like us, very exciting time. Very exciting time.
I already know someone listening right now, they're asking this question.
Yes, ma'am.
Does Cape Fear Valley accept Medicaid?
We do. We accept all Medicaid. So for the managed Medicaids, we talked about previously, we are participating with all of those networks except one right now. Now, we are actively talking with that. My anticipation is that we're going to reach term and be able to be participating in all of the managed Medicaids. But we do accept Medicaid. It is a core part of our community, and we are proud to serve them.
Now, will this also include hospital visits and medication?
Yes, so great question, Ms. Jones. The big pickup in this is prescription coverage, right?
Yeah.
Before you had no insurance yet, now they have great programs, which you mentioned before, CCMAP and other things to help folks. But this is going to be an incredible component. You have automatic coverage to a pretty extensive formulary for your coverages. Not only that, but you'll also have primary care access and different types of wellness access to where a lot of those folks either foregone, did not seek care or went to the emergency rooms. They'll now have a multitude of access points that they can enter.
Awesome. Ladies and gentlemen, with us now, Mr. Bart Pfizer. He is Vice President of Revenue Cycle and Managed Care at Cape Fear Valley Health. Now, if you have questions for Mr. Pfizer, what you can do is give us a call at WIDU at 483-6111. That's 910-483-6111. Ms. G, she's going to answer the phone for you. And then what you can do is leave the question, and she'll make sure that we get that question answered while we have Mr. Pfizer in here with us today. Also, if you're following us by way of the live stream on Cape Fear Valley's Facebook page, just leave the question in the comments section. Lindsay, she's amazing. She'll make sure that if she can't answer the question herself, she'll make sure that we get those questions answered for you today. Finally, I want to make sure that you share the broadcast and see what we're doing at Cape Fear Valley.
As well, that we verify patients' income, and also through some of our grants that we use to purchase some of the generic medications and everything that kind of fill in the gaps. We have to have, proof. We have to verify their income and keep that on file.
What if a lot of people in our community are unemployed, or they did not work last year? So what if a person does not have proof of income?
So if they don't have proof of income, if they did not file taxes this year, then we ask them to get something from the IRS called a verification of non-filing, so that we have something that proves that they did not file taxes. Sometimes we have patients that are, maybe they didn't work last year, they didn't file taxes, but maybe this year they have a new job. So we'll ask them to get a verification of non-filing, and we'll also ask them to bring in a month of current pay stubs. If they're getting unemployment, they can get a verification of non-filing and bring in the unemployment statement that shows what they're getting from unemployment, so that we have some type of proof to be able to send off with the drug companies and everything.
All right. Ladies and gentlemen, Ms. Deanna Thompson, Director of Cape Fear Valley Health's Outpatient Pharmacy, and Ms. Julia McClellan, CCMAP Pharmacy Manager, both on Making Rounds Live this morning. Deanna, how many prescriptions does CCMAP distribute in a month?
So currently, CCMAP's doing over 2,000 prescriptions a month for the
2,000?
patients. Yes, ma'am, for the patients of our community. So they're an incredibly helpful resource.
Wow. Julia, how does a person enroll in CCMAP?
So to enroll in CCMAP is very simple. You just have to give us a call at 910-433-3602. Just tell us, what your need is, and we will walk you through the steps. We'll set up a phone interview with you. If there's something that needs to be transferred from another pharmacy, we'll take care of that. We try to be as proactive as we can to be able to get you the things that you need, so that, we help you the best that we can overall.
Let's talk about length of time between applying and getting the first medication prescription. How long does that take?
When we're screening you on the phone, as long as you meet the eligibility requirements, you can get medications the same day, as long as it's something that we have in stock. So the generic medications, or sometimes we have what we call samples of things that are brand name, the insulins, the inhalers, all that kind of thing. As long as it's something that we have on the shelf at that time, and you have a prescription, or a prescription that we can transfer in if you don't have a paper prescription, then you can get medication that same day that we're doing the interview with you, because we give you time. We give you about a month to bring in those income documents, to give you time to get those documents together. So we'll give you medication that same day, as long as it's something that we have. If it's something that we don't have in stock, because there are some medications that come from patient assistance programs that they might mail it to the patient's house or something like that, and we would never have any extras of anything like that on the shelf, then in that case, then we do the application. Your physician signs it, it comes back to us, and we process it with the drug company with the documents that you brought in about your income and everything. And then it just depends on the drug company at that point, because some companies are pretty quick. They turn it around in a week or so. Some companies take a little bit longer. It can take, 3 weeks or so. So it just depends really. But once you are enrolled with that patient assistance program with the drug company, they normally enroll you for a calendar year, and our staff takes the work out of it for you. They keep up with the reorders, we keep up with the re-enrollments, and so that we're trying to keep you in medication so that you're not running out.
Awesome. You mentioned earlier at the beginning of the segment about the application, because we were talking about it earlier and so forth. Could you repeat that again as far as, because I already know people are asking, is the enrollment complicated? Is the enrollment process complicated? Do you have staff to help people? Could you repeat that bit of information that you gave us earlier?
It's very,
Okay.
I apologize. It's very simple to enroll in our program. We have a website, ccmap.org, and the application is listed there, but you don't need to fill that out on there. If you just want to see the questions that we would be asking of you, the application is there. When you call us and tell us that you need help, we'll schedule that phone interview, and while we're talking to you on the phone, we'll fill out the application at that same time. We'll ask you your name, your address, all of that information. Very simple. We have very helpful staff that is here to help you.
Let's talk about how long a patient can stay enrolled. Is there a time limit? Julie, I'll give you this question. Is there a time limit on how long a patient can stay enrolled in the program?
There is no time limit on how long they can stay on the program. As long as every year we have to have updated income from everyone. So as long as you have updated your income and you still meet the financial requirements for our program, then there's no limit to how long you can be on it. If for some reason you get insurance during that process, we just ask that you tell us so that we can, evaluate it from that point. Because some companies will still help you if you do have insurance if it's not covered. But yeah, there's no limit to how long you can be on our program as long as you keep your income updated and you don't have prescription insurance.
All right. Now, you may have mentioned this earlier, so Deanna, I'll ask you this question. For our listeners that are on Medicare, can the program still help them?
Yes, the program can still help Medicare patients. As Julia mentioned earlier, they wouldn't be fully enrolled in our program. They wouldn't have access to our generic medications. They would, however, be able to apply for some of the patient assistance programs through the drug manufacturers. A lot of those drug manufacturers will still help you. They know their branded products can be expensive on some of the Medicare plans. So it is a case-by-case basis. You'll have to call the team at CCMAP. They can get your income level, and a lot of times if it's a really expensive medication on your Medicare plans, they can help you. Again, it's a case-by-case basis, but yes, having Medicare does not exclude you from all of our benefits.
Ladies and gentlemen, Miss Deanna Thompson and Miss Julia McClellan are Making Rounds Live. Julia, where are you all located?
So we are actually located in the Cumberland County Health Department. That is 1235 Ramsey Street. It is in the same parking lot as social services. It's just the shorter of the two buildings. So when you come in the main awning for the health department, the pharmacy is directly to the right as soon as you come in.
All right. And what are the hours, and how would a person pick up prescriptions?
So our hours are Monday through Friday, 8:30 to 4:30. We do close from 12 to 1 for lunch. The exception is on Friday, we're only open 8:30 to 12, but you can come anytime during those hours. To pick up a prescription, you can pick up your own prescription, or you can send someone on your behalf to pick up that prescription. When you come into the health department, there is a ticket system, so just pull a number, have a seat. That's basically the line, so you don't have to stand there. And when they're done with whoever's at the window, whenever your number comes up, they'll call you up and they'll assist you. And whenever whoever is picking up the medication, our staff will just always verify name and date of birth to make sure that we're giving it to the correct person.
Do they need an appointment?
They absolutely do not need an appointment. The only time that you need an appointment is if we're doing your phone interview, because we try to schedule those so that people know that we're calling and they know that we're calling at a certain time, but you do not need an appointment to show up at our pharmacy at all.
All right, Deanna, I know you all mentioned it earlier about about fees, but I need the listeners to know and understand this. Is there a fee for medication CC MAP dispenses?
There are no fees for any medications that CCMAP dispenses. If we
Okay.
dispense the medication, there's zero charge to the patient.
Awesome. Julia, what if someone listening or someone watching right now wants to help support the program? How would a person go about doing that?
Patients can donate, or anyone in the community can donate. The donations go through Cape Fear Valley Foundation office, and that office is actually on Robinson Street in the Medical Arts Building. So you can either go by in person and just tell them that you would like to donate to our program, just mention CC MAP. You can give them a call. I believe their phone number is 910-615-1285. And they also have a website, www.cfvfoundation.org, and you can donate through there. You would just need to designate CC MAP as the recipient.
Miss Deanna, if a person has any questions, how do they get in touch with CC MAP?
So CCMAP can be reached at 910-433-3602 anytime during those hours that Julia mentioned. We also do have the website as well. It's www.ccmap.org. Has all of the business information as well as that application. Like Julia said, we don't need you to fill out that application before you come or anything. We will do that over the phone with you, but it is there so that you can know what we're going to be asking ahead of time.
This is so great. Finally, ladies, did we overlook anything? Are there any parting words that you have for our listeners, our viewers, before we let you go?
The last thing that I'd like to mention is that we do try to be proactive and help our patients the best that we can overall. A lot of times when we're talking to our patients, they will mention something else that they have a need with. They mention that their tooth is bothering them. They'll mention that they don't have a primary care physician. If you don't have prescription insurance, a lot of times you don't have medical insurance. And so in those cases, we will tell the patients that there are places that will help them on a sliding scale fee based off of their income, so that they can see a physician regularly, get prescriptions, and then come to us, and then they get their medications free of charge. So we try to help them the best that we can overall, refer them to other resources in the community that they need. If they say that they're struggling with transportation, then we try to help them with those, give them a phone number for that, or if they're struggling with food or anything like that. If we know of a resource that we can help them with, we will certainly give them that resource to try to help them the best way that we can.
That is awesome. Deanna?
I would just like to mention that, please don't hesitate to reach out to CCMAP with any questions about medications, or, as Julia said, with other programs as well. Her and her staff genuinely have a heart for helping people. I've reached out to them personally for patients of Cape Fear. All of our pharmacies have. They genuinely want to help you and will do so in any way possible.
Ladies, thank you so much for being on the broadcast today. This has been amazing.
Thank you for
Yes.
having us.
Thank you for having us.
Ladies and gentlemen, please join me again in thanking our guest, Cape Fear Valley's Director of Outpatient Pharmacy, Ms. Deanna Thompson, CCMAP Pharmacy Manager, Ms. Julia McLennan, and we had with us during the first part of the broadcast, Mr. Bart Pfizer. And thank you all for being on today's broadcast. Well, family, it's a wrap. Our next broadcast is Tuesday, December 26th, but we won't be live that day. Since we had some very interesting interviews like the ones we had today, and during the entire year of 2023, we're going to have a year in review on December 26th. So make sure you join us for that. You will be so glad you did. So for our producers, Shaka Jordan and Ray the Brand Thomas, our social media coordinator, Miss Lindsey Graham, and the hardworking team behind the scenes, I'm Omega Jones. Thank you so much for listening and watching Cape Fear Valley Health's Making Rounds Live.
Your station for inspiration and information. 1600 AM, 99.7 FM, WIDU1600.com. We are WIDU Fayetteville. We do radio. Follow us on Facebook at WIDU 1600 AM.
NCN News. I'm Mike Trayley. The state's top law official was in Wilmington on Monday afternoon to discuss social media use for children. Attorney General Josh Stein spoke at Town Hall.
In my office, we're taking Facebook